Healthcare was built by independent providers. If you break your arm, you head to the ED. For general care, you see your primary care doctor. If you need surgery, you find a surgeon and a hospital. This disconnected care can be inefficient and costly. At Carolinas Healthcare System, we believe in connecting care to provide a seamless patient experience. So we've created a model that fosters proactive, personalized relationships between patients and providers. We're calling it Carolinas Healthcare System Care Management. The name is straightforward, but the impact is revolutionary. How does the system work for our patients? When patients come to Carolinas Healthcare System, they're immediately connected with a primary care physician who coordinates with a team made up of several different types of providers. For many patients, a care management team member acts as a patient's main point of contact for the system and coordinates support from scheduling appointments to facilitating referrals. Our patients receive care across the continuum of Carolinas Healthcare System, from hospitals to rehab facilities, and even through community partners like the YMCA. Because Carolinas Healthcare System is connected by a state-of-the-art electronic medical record system, caregivers at all these locations have the background information they need to properly treat our patients. And by using analytics, Carolinas Healthcare System is able to predict a patient's future problems and intervene before they start. Here, a patient's treatment isn't confined within the walls of a hospital or doctor's office. Our care breaks free of buildings in Charlotte and goes wherever our patients are. Apps and websites like My Carolinas help patients keep track of their medical history, test results, and appointments from a laptop or smartphone. And virtual visits allow patients to see a doctor from the convenience of home. So how does this work exactly? Let's meet Jane. Jane logs into Carolinas Healthcare System for a virtual visit to help soothe her sore throat. While updating her electronic medical record, Jane's nurse practitioner notices her diabetes diagnosis, which she hasn't been treated for in years. Jane finishes her virtual visit with care instructions for her sore throat. But there's more. 2 days later, a nurse calls and introduces Jane to her new care team. First, they check to make sure Jane's taking her sore throat medication. And since Jane hasn't had a physical in so long, she's scheduled with a primary care doctor right in her neighborhood. The team creates a wellness plan for Jane and connects her with the local YMCA, where she learns how to control her rising blood sugars. Financial navigators assist her with billing and insurance questions. And before you know it, she's using My Carolinas to email her doctor, check her lab results, and find exercise and recipe videos. A year later, Jane is sick less often and making fewer trips to the ED. And she's actively involved in improving her health and her family's. The great part is that Jane's care management plan may be totally different from Ted's, or Steve's, or Annette's. Whether a patient is already ill, at risk of getting sick, or generally in good health, each person gets a plan tailored specifically to his or her needs. Carolinas Healthcare System's care management model helps them become healthier, keeps them out of the hospital, and decreases the overall costs associated with healthcare. And that makes everybody happy.